Since the end of August, the number of new COVID-19 infections have surged in people under the age of 40. That age group now makes up almost 50% of all the cases in the country. So some experts are saying this is due to a lack of clear messaging about the virus reaching their generation. But a Toronto doctor has found a way to connect to a younger audience and educate them on the important information that surrounds COVID-19. This is all through the power of TikTok. Palliative care physician and health justice advocate Dr. Naheed Dosani is joining us now. Good morning to you.
Good morning. Thanks for having me on the show.
I'm so glad you're here and in person, although I've been enjoying watching your TikTok posts. Some of these videos have now nearly reached 200,000 views. And so just to give everybody at home a sense of what we're talking about, I'm going to roll a clip for you. Hang on. We know that TikTok is one of the most powerful social media platforms on the planet. What is it about your videos that are resonating with young people?
Well, I'm a palliative care doctor, and I actually started on TikTok to provide education around complex issues having to do with serious illness, what it's like to support someone as a caregiver, the difference between hospice and palliative care. And I was actually blown away by the response. And then the pandemic happened. And I started to make public health messaging that was more focused around, physical distancing, infection control strategies, Health Canada updates. And people were really into it. Trendy videos, text boxes, and music too.
We're showing everybody right now the one that's titled Why Docs TikTok, which I guess is essentially my question. Why do docs TikTok? But where do you get your ideas from? Because TikTok has a range of ways to get your message across.
For sure. I'm scanning public health messaging. I'm following, Health Canada and, here in Ontario, their messaging. And I'm taking these complex, nuanced messages, and I'm realizing that people, particularly under 40, are not getting these messages. So I choose some of the more complicated messages, and I try to find a trendy or innovative way to package it so that people can get access to that information, because I don't think people are getting access to this information, and they need it, because not everyone's able to watch these press conferences that happen in the middle of the day, because people under 40 are either at school or at work.
Doctor, I want to ask you about permission, because a lot of the frustration from the client-based perspective is that the information is there, but it's very confusing to get to. If you go on the different websites, you have to scroll through so much writing, and there's been a real push to bring healthcare and make it more accessible for clients. But there's been some resistance from the regular colleges. You skipped ahead of all of that and went right on to TikTok. How's your message been received by other doctors and by the boards?
I think at the outset, people were a little bit shocked and surprised that I would use this platform for this purpose. But I have to say, people have been really positive. I've heard from the medical schools, I've heard from patient advocacy groups that this is a really person-centered approach. It's a relationship-centered approach to delivering complex messaging. This is an example of how we can meet people where they are at in healthcare. It's not what we often think about how healthcare messaging can be delivered, but I think it's the way of the future. So I'm really happy to be getting positive feedback and a really good reception to the work.
We started off this interview by pointing out some of those stats, which is that 50% of the cases right now are people under the age of 40. What is your message to them today?
So my message is, I understand, that this has been a challenging time. I talk to people who are under 40, and they say, we care about this virus, we care about this pandemic. We just don't resonate with messages that are, really focused on blaming and shaming us. And I think that's fair. And so messages that are positive, engaging, innovative, that's a way to connect. My advice has been what I'm saying in my videos. This weekend around Thanksgiving, stay home, stay 2 meters apart, wash your hands, wear a mask. Our actions are very much critical, and we can actually save lives with these actions.
It's been a pleasure to talk to you today, Dr. Dosani. Thanks for coming on Your Morning.
Thank you. Have a great day.
Yeah, happy Thanksgiving.
Yeah, you too.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.